Hasa is the health information exchange responsible for the San Antonio, Dallas-Fort Worth, and Corpus Christi areas of Texas. While our main service is aggregating real-time clinical data for better patient care, we also want to make the delivery of healthcare easy and efficient for individual providers, hospitals, patients, and insurance companies by offering additional reporting and analytics functionalities. And we do all this within strict security and privacy guidelines. Our aim is to become a user-friendly tool that everyone can utilize and is easily accessible. Our functionalities include a community health record, analytics tools that can report readmissions, alerts reports that can identify when patients have been admitted into participating hospitals, a closed-loop referral system, a community referral tool, and assistance in case management for gaps in care. Hasa wants everyone to have exactly what they need to make high-quality care more efficient.
My name is Jeffrey Crabtree, and I'm the Senior Vice President for the Methodist Healthcare System. Methodist Healthcare has been a part of Hasa as a founding member since 2006, when I first served on the board and still do. The original reason why we began Hasa in 2006, we recognized that in the ED there are a lot of people who access the ED, and they access EDs all across the community, whether it's Baptist or University or Methodist or Christus. And we wanted to see if we could actually put together patient records that would reduce the number of diagnostics, actually make healthcare more efficient, but also make it better for the patient. We recently embedded the Hasa link into our EMR, and so if a physician in the ED, as an example, takes on a patient, and he believes that patient may have experienced a visit someplace else, maybe a physician's office, it's a member of Hasa, or maybe another hospital, he has the ability to actually click on a button on his desktop and go right to that patient's name if the patient is in the database. Of course, it's all very private and very secure, and only available if you as a patient request or don't opt out of being in the database.
I am George Thomas, Chief Operating Officer for Methodist Healthcare Ministries and Chair of the Hasa Board. We have been partners with Hasa since 2006. They have been integral in allowing us to be able to aggregate data on the health of our population. As you know, Methodist Healthcare Ministries takes care of the unfunded, the low income in Bexar County and across South Texas through partnerships we have with funded partners. Hasa has the ability to collect information from various hospitals in San Antonio, and being able to look at that information in aggregate format allows us to see who are utilizing our emergency rooms more rampantly than others, what are the treatment plans in place that are effective and not effective. In fact, recently we were able to identify diabetic patients who have been going to area hospitals, and that allows us to be able to, when patients come back to us, to be able to look at the hospitals they visited the day before or the week before, and be able to follow up with discharge information from physicians in the hospitals. More recently, one of the benefits that Hasa is providing to us and to our partners is data on population health. By looking at the information that Hasa collects using IMAT, we are able to triage these patients more appropriately. Over the years, as Hasa has begun to grow and develop its assets, we have been able to enjoy the benefits of data aggregation, being able to understand what are the effects of the treatment plans we have in place in taking care of our patients. And it's allowed us, I think, more broadly to be able to look at population health as a mechanism to treat and ensure sustainable health outcomes for all of the people we serve.
I'm Greg Giesman, CEO of Community First Health Plans here in San Antonio. We've been participating with Hasa since 2014, when we became aware of their emergency room and inpatient admissions notification systems. Those are important things for health plans as part of our care management activities. For ER visits, could indicate an individual who doesn't know how to access our system, who's using emergency rooms as primary care physicians, or individuals who are candidates for our disease management or case management programs. Historically, we did these activities manually, looking at claims reviews. In that case, there was a possibility that we would miss someone for follow-up, or at the very best case scenario, our data was at least 30 days old. We're looking at their readmissions analysis now, and we are testing that on our Medicaid population. As more physicians enroll in Hasa, we look forward to using their data for our HEDIS collection activities to minimize the burden of manual chart reviews on both providers and Community First Health plans. The daily alert system works into our workflows. It provides us real-time data on our members, our providers, patients, and allows us to begin as soon as possible all of our care management and disease management activities.
My name is Paul Wynn. I'm the president and CEO of Community Care Health Centers. We've been part of the founding board with Hasa. Back then in 2006, we were looking at ways to track our patients that utilizes the emergency room, other hospitals, patients that are seen as patients of ours, but it was difficult to track where they went to get their health care. We didn't want duplicating labs or x-rays, so this was one opportunity with a technology that's being developed in San Antonio back then to track our patients, but also to obtain their healthcare information so that we're not duplicating services to them. The advantage is, for example, if the patients go to the emergency room, now we have an alert system that goes toward our provider so that when the patients go get seen in the emergency room, we now have some sort of report that we can pull from as far as what they were seen in the hospital for, whether it's the emergency room or if they got admitted or if they got discharged. Now we have a better understanding of what they were seen for so that later on when they do come back to see us upon their discharge, now we can do a lot more preventive medicine or even address them in an ambulatory setting, as well as provide them with a better care to follow up so that it will prevent them from further utilizing the emergency room system.
Hi, I'm Dr. Brian Alsip. I'm the Executive Vice President and Chief Medical Officer for University Health System. Like most of the other major health systems in Bexar County, we've been one of the founding members and participatory in not only the data submission, but also the use of data that comes out of Hasa. As a health system, we're also the only academic medical center in San Antonio and Bexar County. So we see some of the most acute patients, most gravely ill patients, and we also take care of a lot of patients who don't have funding sources. As a health system, we have a large medical group. It's called University Medicine Associates. It's composed of doctors, advanced practitioners, who provide a combination of both primary care and specialty services. They use Hasa on a daily basis, primarily to find out where our patients are seeking care and whether they've been admitted or having been seen in emergency departments in other healthcare facilities. It provides information that's helpful for those providers, again, to not only see how they're using our system, but see how they're accessing other services.